I am Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Let's try to understand how thyroid disorders can lead to infertility and what are the treatment options. So, what is thyroid? Thyroid is a small butterfly-shaped organ which is placed in the front of your neck, in front of the trachea, and it's responsible for proper functioning by way of regulating metabolism of various organs inside the body by the production of two important hormones. The first is T4, also called as thyroxine. This is a very important hormone, and the next is T3, also called as triiodothyronine. So these two hormones are very important for regulating various body functioning. Now what happens if there is a problem with the release of these hormones? There could be problem with the ovulation, there could be irregular menstruation, infertility, and also the risk of miscarriage when these thyroid hormones are not regulated properly. Hyperthyroidism is the increase in release of hormones which are released by the thyroid. So what happens is that because of too much of thyroid hormones in the body, there can be some symptoms such as increased heart rate, accelerated weight loss, excessive sweating, anxiety and nervousness, increased sensitivity to heat, irritability and insomnia, frequent bowel movements, sweating hands, trembling hands, hair loss or breakage also. Hypothyroidism is the decrease of production of these hormones, which could lead to the following symptoms: decreased heart rate, weakness or fatigue, accelerated weight gain, low concentration and memory capacity, increased sensitivity to cold, muscle or joint pains, pale or dry skin, constipation, depression, hyperprolactinemia. There could be anovulation where you do not ovulate properly. So when the levels of thyroid hormones decrease, the thyroid released by the pituitary increases to try to maximize thyroid gland activity. So what are the causes of thyroid malfunction? In general, the main cause of these thyroid hormones not being maintained properly is the malfunction of the gland itself. But let's look at some other causes that can result in thyroid disorders. Excessive iodine diet, thyroiditis, which is the inflammation of thyroid, thyroid nodules or cysts, or benign tumors in the pituitary gland also can lead to thyroid disorders. Hypothyroidism, on the other hand, could be due to surgery to remove the thyroid gland, radioactive therapies against cancer, drugs such as lithium, etc., iodine deficient diet, congenital defects, etc. Thyroid is diagnosed very easily with a blood test, but look at your symptoms. Maybe you're sweating, dry skin, the symptoms that I was talking about. If you're able to identify those, then getting a thyroid or total thyroid investigation, which is called as thyroid stimulating hormone, total TSH, all these can be examined and then the diagnosis can be reached for proper treatment. Many medications are available for either hyperthyroidism or hypothyroidism. All these, when taken properly, can definitely regularize a dysregularized thyroid gland. So do not be disheartened. This can definitely be treated, but you need to consult your physician immediately, especially for pregnancy, when you are not ovulating properly, when the periods are irregular, when there is weight loss or weight gain because of thyroid disorders, then pregnancy can be an issue, and your fertility specialist, when diagnosis all this, can give you proper medication. To understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.